Hello, everyone. My name is Kira Moore, and I'm one of the directors here at MSE. And I have been working with the critical care team throughout COVID during the first wave of the pandemic and the second wave. Um, Before we start, I just want to say it's a fantastic opportunity to learn more about the roles available within our team, as well as hearing from our frontline staff themselves to give you a real insight to the job that they do. And we'll take you through the agenda, but after the talks from various members of our critical care team, we will give you the chance to participate in questions and answers session with staff at the end of the webinar. So thank you so much for registering your interest in our critical care recruitment event tonight. So Mid and South Essex NHS Foundation Trust is now one of the largest trusts in the country, serving a population of 1.2 million people, and we're recruiting to our new MSE Critical Care Centre. If you're a nurse, allied health professional, administrator or consultant with an interest in critical care, we want you to be part of our new team. MSFT comprises of sites across Chelmsford, Basildon and Southend, and our critical care division is the largest in the east of England. We're investing significantly in our hospitals to create truly world-class facilities to benefit both our staff and patients. There's never been a better time to join us. At MSFT, our new MSE Critical Care Centre offers unique opportunities and training across our 3 sites to share best practice and develop knowledge. We are forward-thinking, friendly, and focused on making a positive impact in everything we do. This webinar is a great chance for you to hear from various members of our team as we talk you through the steps to take before applying for a role and what you can expect working as part of critical care. I'm going to introduce you now to Jill Donoghue and Frita, and they will tell you about their experiences as nurses in critical care.
Hi, I'm going to go first, I think, and I'm going to talk a little bit about how I ended up in critical care and what it's like being the matron of one of the units. So I'm the matron at Southend Critical Care, and I have been in critical care at Southend for about 20-ish years. And prior to that, I'd worked in lots of places across various different hospitals. And I'd always steered away from critical care because I thought that it wasn't for me, but became quite disillusioned with ward work because what I really wanted to do as a nurse was look after patients. And so I decided to take the leap and come to critical care. And it hasn't disappointed. Even now, in my role as a matron, on a daily basis, I'm involved in actual patient care and supporting relatives and patients through probably the worst time of their lives. Since arriving in critical care, I've obviously been very fortunate to be able to progress. I'm doing I've done a degree, my master's degree, critical care courses, teaching courses. So I've been very fortunate in progressing and veered towards an educational type of career pathway initially within critical care, and sort of ended up as a matron a bit by default. But I've been in this role for a couple of years now, and honestly find the challenges a delight most days, shall I say. What's it like working in critical care? For all nurses, I think that work in critical care, one of the real achievements is that you are so involved with your individual patient, because generally our ratio is 1-to-1 for level 3, the ventilated patients, or 1-to-2 for the high dependency patients. So we get a chance to really deliver care and really know our patients and our relatives, and that gives you great job satisfaction without a doubt. If you came to work within one of the critical cares, I think one of the big advantages are that because we're such a diverse group now, there would be opportunities that you could potentially move to other specialist units. And we have developed really good working relationships across all 3 sites that make life really rewarding, I think, because we share good practices and we learn from each other. On a day-to-day basis, working in critical care can be exciting and sometimes less so, but never 2 days are the same. And that's one of the other enjoyable things for me. You can, as I said, deliver patient care, get to know your patients really well and develop. For a new nurse coming in that hadn't got any critical care experience, all the units would give you a supernumerary period, and that would aim between 4 and 6 weeks, depending on your previous experience and how you're progressing. We work towards a national STEPS competency framework, so it's something that's recognised nationally. And once you've done your induction period, then you'd be buddied alongside somebody to work with over the next few months so that you can get your skills up and feel much more confident. Once you've developed just your initial groundings within critical care, you'd work through your STEPS competencies, and then there would be opportunities to undertake the critical care course. Here at Southend, we run a transfer course in our simulation suite. We do study days several times a year for the newly appointed staff to ensure that they've got the knowledge that they can then apply into practice. So there's lots of skills that you need to learn, but you need to have the underpinning knowledge, and that's really important within critical care. And that's something that we're all passionate about across 3 sites. Exciting to come and work in critical care now because there's so many opportunities. And I think that's probably it from me. So I'm going to hand you over to Frita.
That's wonderful. Thank you, Jill. Welcome, Frita. It would be great to hear your story.
Hello. I'm Frita. I'm one of the qualified nurse. I work as a senior sister in critical care in Broomfield Hospital. My journey has been a long, actually. I worked in intensive care in Broomfield for 17 years now. I'm going to start the journey like from where I started, actually. So I was an overseas nurse recruited. We were the first overseas batch who came from India to Broomfield Hospital in 2003. So I was landed in intensive care because I have experience in intensive care back from India. So the overseas program was slightly different that time, like compared to what it is now. So we had like an induction pack, and to be honest, the support we received from the managers and from the senior team from intensive care was so fabulous. And within 3 months, we were able to finish the overseas program, and I was adjusted there to work. And throughout the time, like, you have been well supported by senior team and a clinical facilitator team. And we also have teaching every day, and we have ward rounds every day, and we are supported by the doctors. The whole team is very supportive. With my journey, if I want to say, so I have done several courses like mentorship. So after 1 or 2 years, once you settle down, you can do high dependency course, and then moving on is a critical care course, and then you can go into management or a facilitator role. So there are opportunities however you want to do it according to your skills. So I choose the pathway for management, and I was a junior sister for nearly 8 years in critical care. And then I also had the opportunity to study my master's in advanced practice nurse. And I also worked in resuscitation team and hospital at night. So you also be exposed to the other teams which is linked into critical care. Like, you can work with the research team and also with resuscitation team. So I have developed to a senior sister. So you can imagine the support what I've had. So what the currently support we offer is the Band 5 development pathway. The previous screen, Kiara, sorry, the previous slide. So the Band 5 development pathway is like when someone comes to our unit as a new nurse, like as a Band 5, when we recruit, we have certain pathways. So as soon as you come, you get your induction and welcome pack. So you get your welcome pack, and then we have formative assessment. So you have a supernumerary period of 4 to 6 weeks according to your experience. And we have got part 1 competency and part 2 competency. So we have got a good few senior nurse as a clinical facilitator. So you work with them, and you also work with the technicians to do the CNST. So that is for the competency for all the equipments, because there's quite a few ventilators, monitor, and all the equipments, whatever has been used in intensive care, we have got a competency framework. So the technicians team will be able to go through with this. And also you've got an orientation pack. So where within the first 4 weeks during your supernumerary period, you'll be able to cover all of the induction pack. And then the clinical facilitator will do a formative assessment. And then you will be commenced on IV booklet. So IV booklet, we also have part 1 and part 2. So part 1 is more of IV antibiotics and all the infusions. As you know, coming from a different trust to another trust, your worry could be like, how are you going to cope? So we have got all the guidelines, the policies, and all the drug infusion protocol, everything we have got in our electronic resources, which is available. That is a big reassurance. And also you can log on to the thing and you can see how you're going to reconstitute and administer the drug. And you also always have the clinical facilitator support on every shift, and also a senior support with you to go through your IV booklet. And once you finish your IV booklet, you again have a chat with the clinical facilitator and sign few papers off. And then you go on to a part 2 competencies, which is the inotropes and vasopressors, where again you may need a lot of supervision and practices, because as I said, each unit practice differently. So we have got protocols and policies in place. And we also have every Friday, we have teaching sessions. So whatever you wanted to have, like your knowledge to be improved, if you inform one of the senior team people, will be able to accommodate it. And following on to the development pathway is the critical care competency framework. So when you finish your induction pathway and you go on to a national competency framework, step 1, there is up to step 4 books. So step 1, you start as a band 5, and when you're on the step 2, the clinical facilitators and the CF will assess you, and the senior nurses will assess, and then we will be able to put you forward for the critical care course. And once you've had the critical care course, you're well mentored, and it's such a good knowledgeable course actually, where you're very independent to look after a level 3 patient. And even we do hemofiltration, you have training on, they have special teams on it. And we also have got post registration, post critical care course competencies. And then you go to a band 6 role, which is a much more senior role, where you'll be supporting a band 5 nurses. And then after you get band 6, you have got opportunity whether you want to go to a management role or a facilitator role. So there is always a progression career in the career. It doesn't stop as a band 5, and you're well supported throughout. And as Jill said, it's been such a amazing experience actually. And even I'm a senior sister now, so I have well hands-on with the patient, and it really gives you a good satisfaction, especially when patients are critically ill and you are the one who is going to be like a lifesaver for them. And it really gives a satisfaction, and with the support, it's an amazing team. And now involving the MSc, actually, as Jill said, it's an eye-opener, and there is huge more experience. You can get cardiothoracic and burns, and there's other specialty experience as well. So I'm sure you'll enjoy working with us. Thank you.
Thank you so much, Freeta, for that very comprehensive understanding of training and the competency pathway. We'll keep moving on and hold for questions onto the end. And now I'd like to introduce you to Michelle, who's going to talk about the allied health professionals. Hi, Michelle.
Hello, everybody. My name's Michelle Perham, and I'm the Integrated Therapy Lead for Cardiorespiratory at Basildon Hospital. It's quite fitting that today is the event, because today is actually National AHP Day to celebrate all AHPs. There's quite a varied amount of allied health professions in critical care, so I'm going to highlight the ones that actually work in critical care with me, but there's actually 14 allied health professionals working in the NHS, ranging from dance therapists to paramedics. AHPs working in critical care include dietitians, speech therapists, occupational therapists and physios and radiographers. So I'm going to briefly try and touch on what these AHPs do in critical care, because sometimes we're a bit of an unknown domain, really. People don't really understand what we do. So I'm a physio by background, and I started my career 22 years ago, aspiring to become a sports therapist. I love football. I wanted to run onto the football field and cure all the footballers' injuries. However, I started at Basildon Hospital and I completed a junior physio rotation in respiratory and critical care. And then my career pathway changed forever after that. I just found the immediate positive effect I had on patients' conditions who were struggling with respiratory secretions, and the range of conditions I saw really interested me. Attending ward rounds allowed me to ask questions and learn things that physios may not ordinarily know. So I found I became really interested in the medical management of patients, and this encouraged me to continue to learn and sort of enjoy physio in the critical care role. Throughout my time, I started at Basildon, but then I did move around, and I worked in the Burns and Plastics unit at Broomfield, and Royal London in London, working in the major trauma unit there, and then various cardiothoracic specialist units. But I did love my time at Basildon, and I chose to return to Basildon in the early 2000s to take up a Band 7 position in physio in critical care at that point in time. So starting with physio, this is obviously my role, and it's not only about managing patients' chest conditions, but also about the early rehabilitation that we do for these patients, which is sometimes forgotten, and getting patients mobile and stronger again sooner rather than later. And these two roles go hand in hand, really, that the more mobile and stronger we can make patients, the better their recovery is going to be and the better their chest is going to be. So we are sort of come from two prongs of managing someone's chest, but also just getting them up and moving again as quickly as possible. The achievement you feel when a patient leaves CCU walking again is really immense. And I think the physios that were on CCU throughout the COVID pandemic really got a sense of achievement of keeping these patients alive and seeing them leave CCU walking, talking, and that achievement is just so immense for everybody involved, really. So being a physio on CCU allows you to use so many different skills, including the respiratory skills I've just spoken about, but neurology skills, orthopedic skills, musculoskeletal skills, everything that we learn at university you can put into practice in critical care. So I'm now a physio manager, and I manage a great team of physios and OTs that are working in the CCU across all bandings, from team leaders, Band 6 therapists, junior staff and therapy assistants. We're a supportive team to each other and the wider MDT, and in the recent pandemic the therapists in CCU played a major role in keeping morale up within the MDT, as well as taking on new additional roles to support the teams. I think we had sort of a make-believe wedding down there one day because one of the physios was due to get married, and this really raised the morale of everybody that was down there. So we really played an integral part while we were down there during the pandemic. Obviously, I manage occupational therapists in the critical care unit as well, and they have a strong focus on the cognitive aspects of patients' recovery, along with delirium and anxiety management, splinting and upper limb rehabilitation. So that's very much part of their daily role. The skills they will put into practice in critical care is neurology skills, cognitive skills and mental health skills that they have learned at university too. We are one of the only few CCUs in the region who've got a designated CCU OT service, which we're very proud of. And we're often approached by other trusts who are asking for advice on how to set this service up. So we really feel we're leading the way with this initiative, and the MSc CCU has allowed us to develop our OT service even more. So we already have 2 OTs, but we're hoping to obviously have 4 or 5. So it'll be a really good team of occupational therapists in CCU. So another profession that people sometimes don't think about in CCU is dietetics. A lot of patients in CCU will be ventilated and sedated and fed by feeding tubes. So my expert dietetic colleagues are experts in assessing the nutritional demands on the patients, taking into account the age, gender and other underlying conditions. They have highly developed knowledge, skills and expertise to manage the complex issues seen in critical unwell patients. And we work really closely together with the dietitians to ensure that when we're rehabbing patients and mobilising them, we're still meeting their nutritional needs and not exhausting them of their nutritional needs. So we work very closely with the dietitians from that respect. The dietetic team are also running a virtual open morning for those wanting to know more about a career in dietetics on Thursday, the 29th of October. So if there is anybody interested, we can send a flyer out for that. And another AHP that works in critical care is the speech and language therapists. They play an integral role in the management of speech, swallowing and cognitive impairments that patients experience in critical care. They have an expert knowledge of how to facilitate patients' rehab with these impairments and have a vital role in tracheostomy weaning, as well as facilitating early communication. Even when patients are still on the ventilators, we can get patients talking with special gadgets, and speech therapists and physios work really closely to get that happening. Obviously, communication is a really important role for patients to be able to communicate with loved ones. So they are also experts in assessing for safety with early oral feeding, which speeds up the patient's progress, and they support managing mouth care, oral secretions, and alternative communication methods. So that's kind of all the AHPs in a nutshell. Radiographers also work down in CCU, obviously taking x-rays, and orthotists sometimes attend CCU to splint patients. I think all the AHPs working in CCU work really closely together in order to get the best possible outcome for their patients. Weekly rehab meetings are happening, which AHPs come together with the doctors and nurses to plan the patient's rehab journey and the next steps. And we have a really strong team ethos, and nobody ever feels alone within therapies. There is always somebody to ask something of. So even if you're a junior member of staff, you'll never be on CCU on your own. You'll always have a more senior member of staff with you. So our recruitment works slightly different in that we have rotational roles as well. So if physios or OTs or dietetics or speech therapists want to try CCU but not quite sure if they're going to like it, our rotational roles allow you to sort of dip your foot in, but also get experience with the other disciplines within the hospital as well. So you can try it out and see if you like it without actually having a static post in CCU. So that's quite a nice way of recruiting into our professions as well. All our professions provide a comprehensive in-service training programme, and we encourage attendance at other in-house training along with the medics or cross-profession training. During the pandemic, there's a lot of cross-profession training between the physios and the speech therapists with trachea competencies and trachea weaning. And I think the speech therapists really enjoyed the training that they got from the physios. So we really promote the cross-profession training and what we can learn from each other, really. So, and a lot of our junior staff actually stay with Basildon Hospital and are recruited into more senior roles. So that's really nice to see as well. So hopefully that's AHPs in a nutshell in CCU.
Perfect. Thank you, Michelle. And clearly opportunities to work across the sites as well with the merger of the organisation and the division. So that's fantastic. Thank you so much. Moving on now to Chris Westall, one of our consultants. Chris, welcome.
Hello there.
Hi.
Can you hear me okay?
Yes, yes.
Good. Well, it's nice to meet everybody. I'm going to very much start like my colleagues that have talked before, which is drawing a bit of personal experience on why I do this and how I got here. And we'll talk a little bit more about the MSc and the restructuring of critical care going forwards. So I'm a local boy and grew up around here and have always felt an attachment to this place, which is one of the reasons I've worked here. And the people, I have to say, have always been fabulous towards me in supporting me in my training and now my consultant career. I'm not really sure why I ended up in critical care. I think, as people have talked about, there are a few main reasons. Firstly, the critical care environment really is set up to allow us as clinicians of all streams to deliver the care to our patients that we all aspire to. And that's because we pretty much have the best of everything. We have the best staffing ratios, the highest proportion of nurses and allied health professionals with postgraduate qualifications. We have time more than anything. And it is that feeling that we can really give the patients and their relatives their full attention and the care that they deserve that generates a real sense of pride in what we're able to do. The variety is a huge thing. No 2 days, as Jill said, are the same, and that means days pass quickly in a good way. I think being able to work within an intensive care unit, particularly within an environment where team, and that is across all of the people that work in a critical care unit, working in teams is so important, and it provides real enrichment to your daily working life, and that translates into friendships and relationships outside of work that are lasting and important, I think. Similar to how Frida touched on things, no 2 days are the same, and the opportunities for professional development within critical care are endless, because the expectation is that our doctors and nurses and allied health professionals really will be the best. It means that we are supported to develop as clinicians, and the resources are there behind us for us to achieve that. And looking beyond our careers in critical care, the skills with which we're equipped and the experience that we draw from really mean the possibilities for your career beyond critical care are endless, and we can go in all different directions depending on our personal interests. So that really is my experience of working in critical care and why I got here. I mean, looking around us, as I say, we do have the best of staff, I think, and it is important when we recruit people, we look for people that are enthusiastic, that have potential, that really want to develop themselves. And if those people are willing to work with us, we will do everything we can to support people to grow as professionals. Within critical care, probably over the last 10 to 20 years, I think there's been a focus much more on collaboration and also diversification. So the old hierarchies that used to exist, where you had consultants and doctors and nurses and people lived within their separate silos, really has broken down. And what we're looking for is much more of a flat structure within intensive care, where professionals are able to contribute equally with their own opinions and their own skills. And because of that, there are multiple different career paths. Now, that not only is within the subspecialties within critical care, whether you're interested in burns or trauma or cardiothoracics or post-surgical patients or medical patients, but even within those parts of a patient's journey. So are you interested in the upfront acute work? Are you interested in more chronic, critically ill patients, or are you really interested in rehabilitation and the outcomes of our patients post-intensive care and reaching into their lives as they continue in the community around us? How do we work in terms of supporting our colleagues around the rest of the hospital to develop their skills and allow them to deliver the care they want to as well in environments that aren't so privileged as a critical care unit? And really looking forward now, the project bringing all of our hospitals together under the MSE banner and recognising the need to develop as a team has given us endless possibilities and endless potential for expansion at the moment. And I think really now is the time that we're looking for people to join us to capitalise on that and really make interesting careers for themselves that add value to the lives of our patients going forward. Okay. Thank you.
That's wonderful, Chris. Thank you. I'm going to invite Paul Arnold on now to tell us a little bit about the new unit, Paul, that you've been setting up in preparation for COVID and the exciting roles, as well as tell us a little bit about your background and why you're part of this great new merger and this great new division.
Thanks, Kira. I'm Paul Arnold. My day job before a couple of months ago was matron for intensive care at Broomfield. I've been in that role for 3 years. I've been worked in Broomfield actually for 24 years, almost as long as Jill Donahue. Before my career in nursing, I was a serviceman, and I digressed a little, you could say, from my previous career to this one. I think part of my personality developed whilst my third time in the forces, and since then has been not being scared of taking on a challenge. I went straight to from qualification to intensive care, which not many people did or do. Whether that was stupid or whether that was ill-advised or whether that was impetuous, I don't know. What you make of it, what you will. I know what I think it was, a bit of everything. Progressed through the ranks, as it were, to become matron 2-3 years ago. COVID hit us, and post-COVID, we pretty much established that we couldn't go through the same thing again. We needed to do it a bit better. And we could, hopefully learn from our experiences, which is what has happened. One of the main major things to come from COVID within Essex has been the establishment or beginning of establishment of a new critical care unit in Basildon, on site at Basildon Hospital. It's currently located in a Fred Banting ward. Within that ward, we have capacity for 24 beds. We are currently recruiting to staff those beds. We've got the kit at the moment. We've got the geographical location within there. Now, one of the, I've never set up an ITU. I took a very, very well-established, extremely high-functioning, high-achieving ITU, very progressive ITU, which I inherited 3 years ago. Now, the daunting challenge of creating a new intensive care unit from scratch within the environs of a place you don't know, with people you don't know, with people you don't trust because you don't know them, is either stupid or crazy. And going back to my decision 24 years ago, probably has something to do with that. But that's a challenge I've took on. And I'm making friends, getting new colleagues, new people I can trust, which is part of the gig. The big issue for me once I've got the kit established on site, there is recruiting. So recruiting, we have 6, 7s, 5s, 4s, 3s, 84s, 27s, whatever you need. So all the nursing grades I'm recruiting into at the moment. On top of this, we've got a few extra goodies that have been given to us. I've got a whole lot of clinical facilitators at Band 7 I've recruited. Absolutely awesome, unbelievable numbers and unbelievable quality of people as well. One of the reassuring things I've found going to another place that, you get very insular and you think that only your place can do stuff really well. Well, actually, going to there interviewing these senior guys for senior posts out there, they're excellent. You can go anywhere in the country and get really good ITU nurses. And, like I say, it's difficult sometimes to see beyond your own doorstep, having worked here for so long. So roles we've got the clinical facilitation roles. I've got some lovely technician roles, which are essential to the function of the kit and the nice clean progression of patients through the unit. We've got within our business case, we've got a clinical specialist for psychological support, which I'm pretty sure it's the first one in the country. The adverts are out for that, so if you're interested, get in quick because it's tomorrow. We've got almost two whole-time equivalents of clinical psychology attached to us. I interviewed one of those posts today and got 2 people to job share at Band 7. Absolutely kick-ass. What do you think of that, Kira? Yeah. We've got...
Excellent.
Thank you all. I wanted that. And we've got another Band 8 coming into that role as well. So normal provision of clinical psychology to critical care is very small. Base is about 1 day a week. We've got 3 days a week per unit. Something we learned from COVID, you can't not learn from something like that. We've got ACCP roles, Advanced Critical Care Practitioner roles. For creating those jobs just now to go out to advert as soon as we can get, as soon as we can create the actual job spec for those. And we've got the medical support lined up for that as well across the site. I think the one thing that I would like to say is if you want inspiration, then go back and look at Frita, because although she didn't mention me by name, thanks for that, Frita. I mentored Frita when she started 17 years ago on Broomfield ICU, and I remember her and a little cohort of friends very well because it was around the time my first daughter was born. So I have a very, very close memory of what life was like then. And seeing those shy girls start who wouldn't speak, wouldn't, talk, wouldn't challenge, wouldn't speak anything louder than a whisper most of the time, to become the forthright, fantastically educated individuals that cohort of girls have become. And Frita just epitomises that. I mean, look where she is right now from 17 years ago, speaking on a webinar such as this. So if you're seeking inspiration for what you want to do with your career in critical care, look no further than Frita, because she sometimes inspires me when I look back. And if I'm looking back at one thing, I would look at pride in my nursing career. I would probably say someone like Frita, to be honest with you, before I start crying. It would be someone like Frita, absolutely inspirational. So, you can do it, you can get it. It might take you a little while in critical care. You won't get promotion quickly.
That's fantastic.
And basically that's me. So, I've still got those posts. If you want to speak to me, my number's out there. And if you want to email me, then do email me, and that's me.
Great. Thank you so much, Paul. So now's an opportunity to go over to you for questions. I have some questions have come in online. If there's anyone who wants to raise a question, just raise your hand on the star leaf. Okay, so I've got some questions that have come through online. One of the questions is what research opportunities are there in MSc critical care? Wonder if Chris could answer that.
Yep. Hello there. So the aim is to build a modern critical care service moving forward. And at the heart of that is intelligence in the way that we handle the data that we generate from the patients we look after ourselves. And we hope that we will become more effective in this through the use of IT solutions, and particularly a new electronic patient record. Moreover, what we want to do is embed research in the heart of what we do, in that every patient we admit to a critical care unit should have the opportunity to participate in appropriate clinical trials related to their conditions in the critical care unit. We already have a coordinated and very effective research nursing team across the 3 sites, which we'll look to expand. And we are currently looking at expanding the governance framework around our research activities moving forwards. So absolutely, research will form one of the core pillars of our critical care service moving forward.
Great, thank you, Chris. Another question I have is the critical care unit OT service. Who can we contact about this service and what it does? Michelle, thank you.
So you can contact me on michelle.perham at btuh.nhs.uk. I'm the therapy lead that manages the OTs and physios, and then I can put you in touch with the most relevant Band 7 OT.
That's great, thank you. And while you're on, Michelle, it seems to be about AHPs.
Oh, okay.
The dietetic open morning on the 29th of October, is it virtual?
Yes, it is virtual. If someone's interested in attending, we have got a flyer, so if they've got an email address, we can send a flyer out to them, Kira, if you send on that email address to me. But it is a virtual open morning, yeah.
Okay. And another question I have is, what are you doing about digital? Is there any digital development? I think we have. So I can pick that up. So the organisation is investing hopefully in an integrated ITU system, which we are going out to demonstrate in the next. We're going to run some demonstrations in the next few months with staff, with the aim that within the next 6 months to a year we will have an integrated ITU system, which will be great for all the team. And then a question for the nurses. What's the best part of working at MSE as a nurse? Frita's still there?
Yes, yeah.
Thank you, Frita.
The best part to work on MSc is like, I think as you, it's a 5 intensive care. So you can work in, like there is going to be opportunity to work on a rotational basis. So we are taking recruitment for rotational nurses. So we do a recruitment in Broomfield where you can work in plastic ward and also in burns intensive care. And you can also work in general intensive care. For every 8 months we rotate on the end of it, we have an interview process and then you get a job and you can choose where you want to work. I think with MSc again you got greater opportunity. We got cardiac thoracic unit, burns unit, and if you want to work close by, if you're in South End side, you got opportunity where you can do a rotational in South End intensive care and Basildon. So there is opportunity, and I think it's a great opportunity because I always wanted to work in cardiac, but Broomfield never had cardiac patients. So I think it's an interesting opportunity because working in different sites, especially if you're able to travel, and then you can choose where you want to work and where you want to settle down. I think as Basildon is like you get a fringe extra allowance, and if you want to work in burn specialty, there's an intensive care and which is a recognized intensive care unit it's the biggest one, burns and plastics in England. So I think working in MSc, you can expose to different ITUs and you can learn different skills and train yourself.
Fantastic. Thank you, Frita. So if there's any more questions from anybody, just raise your hand. I'll give it a few seconds. Okay. Thank you. The next stage for you to join this wonderful organisation is to apply for the posts. They are available on NHS Jobs. Or if you want to have further conversations with any of the team who've been on tonight, please do send us an email and we will put you in contact with them so you can have direct conversations with them. I hope we've inspired you to join this newly merged organisation, newly merged division, and it truly is one team working together. Thank you very much for joining our webinar tonight.